What blood tests do you need to start with before you get on HRT to get a base level? What are the blood tests you recommend?
You need to do a blood test, certainly, and the blood test you need to do is in blood, is testosterone, total testosterone, SHBG, sex hormone binding globulin. The hormones are transported in blood by proteins. If there's too much of those proteins, sex hormone binding globulin, it keeps the testosterone in blood and doesn't go in the target cells. And the ratio between the two gives us an idea of how much testosterone go in the cell. So testosterone, SHBG, and then very important, the metabolite of the male hormone dihydrotestosterone called androstenediol-gluconide. The higher the value is of the androstenediol-gluconide is, the more you're risking of losing your hair. Male pattern baldness. But the lower it is, the less your erections are. So basically, you need to find the right ratio. It has to be high normal, but not above the upper reference range or near the lower reference range. And so these values are really important, and then it's not enough. When men make testosterone, testosterone can go to convert to the supramale hormone dihydrotestosterone, but it also can convert to estradiol. So if your estradiol level is too high, it will block the testosterone effects. It will block the receptors to testosterone. So we need also to ask estradiol. And then for experts, there's also pituitary hormones called LH, FSH, prolactin. But this is not essential in all cases. But we do many testing. But basically, what the 4 tests I ask you: total testosterone in blood, SHBG, androstenediol-gluconide, and estradiol are the major tests to identify testosterone deficiency in men by the lab test. Okay. But you need also to do a questionnaire looking at the complaints they have of testosterone deficiency and look at physical exam. It's really interesting to do a very good physical exam, because on the body of a man, you can see how much deficiency there is and to what degree the extent is. The final result of testosterone on the body.